Hello everyone, this is Huzzan Waqar here and I'm representing International Rescue Committee Pakistan, and I will be speaking about the COVID-19 campaigns, RCC campaigns that we have run within the country, and how we've included vulnerable groups to provide them equal representation within the campaigns that we have executed. Briefly skimming through the overall campaign that we've had, and then I will be speaking particularly about the transgender work that we've done. So we've managed to reach out to 33 million people with our mass awareness campaigns, and this includes general population, frontline health workers, persons with disability, women caregivers, transgender people, people with disabilities, elderly persons, etc. Um, Key messages. What were the key messages that we used? We've seen very heavy messaging around COVID-19. Everybody has their own messaging. The telecom networks have their own networks, have their own key messages, sorry. The people providing food have their own key messages around this, etc. And we actually thought that what was the niche? Why are we doing these messages? So we are doing it for the communities that we are serving. So what we did was that we went down to the communities. We actually asked them about COVID-19. What was the misinformation that they had? What were the perceptions they had? What were the challenges that they are facing? And then we developed our key messages around the information that they provided us. The messages were then sent to our technical coordinators, protection coordinator, and a health coordinator, economic well-being coordinator, to see the authenticity of the key messages, and they were then triangulated with WHO and Government of Pakistan guidelines to make sure that the key message that we are giving out is well-rounded. It provides maximum information and it speaks to the communities. We spoke about awareness about COVID-19 and its symptoms, hand hygiene, social distancing, misinformation. This has come across as a very big theme during COVID-19. What to do if you're home isolating? What are you doing if you're caring for a COVID-19 patient? The psychological support that is required, uh, and then providing support to vulnerable groups. That has been one of the key messages that we have worked around as well. The mediums that we've used. So quickly, we've used billboards, we've used animated films, we've used radio, digital campaigns, television advertisements, most recently an Android-based game for children. We produced a rap song. We've done MHPSS kits for children with games, interactive material. We've done IC material for the communities to provide them immediate, snappy information around COVID-19. We've done robocalls. We've done on-ground sessions. We've done a tippy tap campaign. We've done posters on ground as well. And this is the kind of mediums that we've explored during COVID-19. The idea is that when we're exploring multiple mediums, we're reaching out to multiple audiences. We did not want to rely on a single source or a few sources and then restrict the outreach of the campaigns that we are running. Additionally speaking, this came from the rapid need assessment that we did IRC Pakistan conducted at the very onset of COVID-19 when the first cases started coming in, and then later on an information need assessment that was carried out to guide the RCCE work that we are doing. Now coming down to the IRC's superheroes, we've spoken about transgenders leading the social change in Pakistan. And this, of course, did not come up in isolation. IRC Pakistan was already working with transgender communities under one of our Water for Women streams, and we were working on water governance with them. They were very actively engaged. We had sessions within the country program on sensitization of the staff as well before hiring transgender persons within our team. And that is the discussion was already there. And when the opportunity of doing the campaigns came up, we were sitting down on the drawing boards discussing amongst ourselves that we wanted to have characters people could associate with and listen to them around the COVID-19 messages that we were giving out. Uh, this was an attempt of providing the messages in a more creative manner that actually speaks to our audiences. And we said again, going back, what is IRC's niche over here? And that is assisting vulnerable people, helping them out, making sure that they are part of the discussion, that they are not left behind. And that is when the idea of a transgender superhero came in. And Bijli came into being. Bijli is Pakistan's first transgender hero, a work that we are immensely proud of at the country program level, and also because this was an opportunity that we took. That COVID-19 messages were generally very acceptable within the communities, and we said, why not use this to break the stereotypes around uh, transgender people within the country program, within the country, of course. Sorry. This was also a multiple thing that yes, we are one breaking stereotypes. Second, we are providing them representation, and third, we are giving a very safe message through them. So it was a kind of a win-win situation for everybody involved. Of course, we had our risks that we thought about, that we discussed, and we said that maybe this is something that we are willing to take. This was also part of a discussion, an ongoing discussion within the country program, that what is the actual support that we can provide to the transgender people we are working with during the COVID-19 campaign, because of course they were affected in a very acute manner because most of their earnings come from celebration, from events, from performances, and that was, of course, all stopped during the lockdowns in the first wave of the COVID. So we developed Pakistan's first animated transgender hero, and she led a team of a total of five superheroes. The voice artist that we used for Bijli is a transgender as well. Bijli was published in over 20 online publications and was shared by 50 digital influencers. This also included some of our celebrities in Pakistan, which actually shared it on their own personal Instagram or Twitter handles. The character description that we took over here was that she's somebody with a lot of authority. When she speaks, people listen. She's somebody who's out there to help people, and people are actually willing to take her help. This is something which is not generally happens within Pakistan. We see them in a very particular light, and this was an opportunity that was there to kind of break those stereotypes, to say that these are all the characters that are there in all of us, in all men, women, transgenders, and why not? Why just we associate particular characteristics with particular um, genders? So it was our attempt, and it really was very successful given the organic reach. And then Sumru, one of our less celebrated superheroes. Sumru is a person with disability, and we just wanted to show him in a superhero light as well. That it's not only your physical being, your physical strength that is your strength. It is also your mental capabilities which make you a superhero, and your ability to go out and help other people. Um, this was an attempt to include inclusion in our campaigns. Um, how to deal with disability is was one of the key themes, and how to support people with disability was one of our key themes of the campaign. And of course, having representation was very important. Sumru's character description was that he's a brilliant scientist from Singh. Again, not just this is not just providing inclusion in terms of persons with disability. This is also providing inclusion in terms of rural and urban divide within the country. It is also providing regional representation. So the characters were a mix, so that they speak to at a national level. The key successes that we've had within the campaign are the popularity of the animated film Correctably, and we were very happy to see because we were expecting maybe a more negative backlash. Of course, not all comments were positive, but generally speaking, an overwhelming part of the comments was very positive. Our most recent hashtag in one of our other RCCE campaigns became a top Twitter trend within the country program, and we engaged with 2 million users, and another 9 million were engaged. We were very happy when this happened. The TPTEP campaign was published in around 9 publications. So it was when we're talking about COVID-19, we really emphasize on hand hygiene. We don't really maybe think sitting in urban centers. I'm not talking about our sector. I'm talking about wider communities, that water is not available to everybody. So this was one of our attempts to actually show that how we can actually make water available with very limited resources, um, to still kind of continue with our key message of hand hygiene from prevention of COVID-19. The reach and scale of our campaigns has been amazing. Of course, this also has the kind of investments that we've made, both in terms of staff time and then the kind of budgets that we've had, and it has paid off. And then the organic following of the campaign has been tremendous. So organic reach, when we're talking about our Bijli was actually covered in Express Tribune, which is one of the leading English dailies of the country, Dawn, same. Then Propaganda, 24th Promos, Womanistan, Mashable, the News Run, all social media platform channels over there, which have huge following. And they were actually picked up Bijli, they actually celebrated it, and then celebrated the development of Pakistan's first transgender hero, again work we're really really proud of. You can't really see it behind the video recording over here, but we've also mentioned FM 89. So I was commuting to work one day and I was listening to the radio and I actually heard the complete script of our animated film on radio, and I went to the office and I was like, oh, did we really pitch it to the radio? Because it's a visual thing, the animated film, and we really didn't consider it. And none of our team members was actually aware of it. So the radio channels had also picked it up on their own, and they actually kind of aired the script only. Again, a huge success for us because there was a very clear distinction in the voices of the artists that we selected so that they could actually come up as really authentic. We've continued using the superheroes in our multiple campaigns. We've had artwork, billboards, we had a rap song they featured over there in the animated video, and we plan to continue using the clout around them for our campaigns. Oh, and by the way, we also have a plus size superhero. We have a singer who is a superhero, and then we have a health worker who is a superhero. So, really a good mix of different characters people can really associate with. Again, coming to the original marginalized representation, it is part of all our campaigns. It is part of the radio work that we've done, the robocalls that we've done, the other work that we are continuing to do, specifically around persons with disability, female characters, and transgenders. They are really represented out there, and we really want to continue doing that to bring the social change, not just preventing from COVID-19, but also showing them in a different light, so that we at least start having those conversations in the mainstream. And then the key learnings. Not all comments, of course, around Bijli were encouraging, and this is something that we were really aware of. But yes, just I've just mentioned this thing that we are happy to have initiated this conversation in the mainstream media. The male audiences on the digital platform are really high. Like 86% of our total audience is men, sorry, and then 14% only are female. How we have countered this situation is by introducing multiple mediums, and then specifically when we are talking about robocalls. So we've made calls to women primarily to make sure that they are part of the conversation. They are reached out. Radio as a medium did not really prove to be that effective for us. Uh, in fact, in our information need assessments and the rapid need assessment that we've done earlier, radio did not come as a top medium for information for our clients and communities. And then a short term campaign with heavy messaging had more retention as opposed to campaigns that are run over a period of time with periodic messages. So yes, our learning is that whenever now we are doing campaigns, we really have 3 months of heavy campaigns when we have the same message on television, on digital campaigns, on radio, on robocalls, etc., to kind of hammer it to the audiences that we are working with and our clients, of course. And that is it from my end. I will be really happy to take any questions or comments that you have. So please do let me know.